Live for Lolly is a harm reduction provider in the Chicago area. Its staff travels regularly throughout the suburbs, handing out drug test strips as part of its outreach.
We go through thousands a month, so people are using them, which is good. Does that stop people from using? Probably not. But at least people can be informed.
Laura Fry is the organization's executive director. She says it's unclear if there's a test strip to detect the latest product being added to the street drug supply.
There is not, to my knowledge. We currently give out fentanyl, xylazine, and benzodiazepine test strips so people can test their supply.
According to these alerts sent out by the state and Chicago's public health departments, medetomidine is now working its way into the illegal drug supply in Illinois.
It's scary. It's a scary world out there for our friends who use drugs.
Medetomidine is an animal tranquilizer, similar to another one already being found in street drugs across the country, xylazine. The city's alert stated multiple drug samples collected from the west side last month tested positive for elevated levels of medetomidine, while the warning from the Illinois Public Health Department says it was notified that multiple individuals had presented at 4 different hospitals in Cook County with symptoms of opioid toxicity.
We did get notification that some of our participants that come to our mobile outreach in Oak Park had overdosed, and this was found.
According to IDPH's alert, medetomidine has only been found in Cook County so far, but it's been popping up sporadically across the country for the last 2 years.
I'm very concerned about individuals mixing in medetomidine into any drug it's not supposed to be mixed with, particularly illicit drugs on the street.
Dr. Amber Hopkins is the National Director of Anesthesia for Thrive Pet Healthcare.
This particular medication is not labeled for use in humans because it hasn't been studied. That specific drug has not been evaluated in humans, and it does have fairly significant side effects.
Primarily used to sedate small animals, Hopkins says those side effects could include decreased heart rate and blood flow.
So a normal beat is about 60 per minute, and it's going down into the 20s.
Dr. Sarah Byers, the Regional Medication Safety Director for Loyola Medicine. She says that's how low a person's heart rate could drop if they've ingested a street drug mixed with medetomidine. Byer adds having a heart rate in the 20s could lead to brain damage or death.
What the physicians are finding is there's no reversal agent for this currently in humans. So what the physicians are treating is they're treating for respiratory depression.
The alert from the state's public health department also noted patients were not responding to naloxone when doctors administered it.
Whenever they're using extremely high amounts of naloxone and it's not treating the patients, that's when they get concerned that medications can be laced with other things.
Byer says doctors were giving 3 to 4 times the normal dose of naloxone and not seeing a response. She also adds high amounts of naloxone will not harm the body. Compared to xylazine, medetomidine does not inflame skin wounds, but it's considered to be more potent. According to the Chicago Public Health Department's alert, it's been found combined with several drugs, including fentanyl, heroin, xylazine, and Xanax. Elizabeth Matthews, Fox 32, Chicago.